NHA Medical Assistant Questions and Answers. Question 1. When blood was collected into a serum tube, why should the assistant allow a serum specimen to clot before centrifugation? Option A. Documents that required storage conditions were maintained. Option B. Helps locate the specimen and reduces risk of lens-slide contact. Option C. Supports proper clot formation and reduces fibrin interference. Option D. Prevents runover between pads and distorted reactions. The correct answer is option C. Supports proper clot formation and reduces fibrin interference. Allow a serum specimen to clot before centrifugation because it supports proper clot formation and reduces fibrin interference. Maintaining reagent and equipment temperature logs documents that required storage conditions were maintained. Beginning microscope focusing with low power helps locate the specimen and reduces risk of lens-slide contact. And removing excess urine from a reagent strip as directed prevents runover between pads and distorted reactions. Question 2. Why is following provider-specific scheduling preferences appropriate when two clinicians use different appointment templates? Option A. Creates a fair method for filling cancellations. Option B. Prevents conflicts with workflow and procedure needs. Option C. Reserves enough time for the expected clinical work. Option D. Prioritizes urgent assessment rather than routine scheduling. The correct answer is option B. Prevents conflicts with workflow and procedure needs. Following provider-specific scheduling preferences prevents conflicts with workflow and procedure needs. Offering the waitlist when an earlier opening is requested creates a fair method for filling cancellations. Matching appointment length to visit type reserves enough time for the expected clinical work, and transferring emergency symptoms to clinical staff immediately prioritizes urgent assessment rather than routine scheduling. Question 3. Which outcome supports confirming the correct patient, procedure, and site during a time-out when the team is ready to begin minor surgery? Option A. Preserves specimen identity before it leaves the room. Option B. Confirms required authorization is present before the invasive procedure. Option C. Prevents wrong-patient, wrong-procedure, and wrong-site events. Option D. Holds tissue aside to improve visualization. The correct answer is option C. Prevents wrong-patient, wrong-procedure, and wrong-site events. Confirming the correct patient, procedure, and site during a time-out prevents wrong-patient, wrong-procedure, and wrong-site events. Labeling a biopsy specimen in the patient's presence preserves specimen identity before it leaves the room, while verifying the signed consent before setup is completed confirms required authorization is present before the invasive procedure. Recognizing a retractor as an exposing instrument holds tissue aside to improve visualization. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. What is the main reason to reschedule promptly when the provider becomes unavailable when a clinic session is cancelled? Option A. Preserves access for problems needing prompt evaluation. Option B. Reduces patient inconvenience and preserves continuity. Option C. Prevents the room and team from being overbooked. Option D. Prevents conflicts with workflow and procedure needs. The correct answer is option B. Reduces patient inconvenience and preserves continuity. Reschedule promptly when the provider becomes unavailable. This reduces patient inconvenience and preserves continuity. Reserving urgent slots when the practice uses them preserves access for problems needing prompt evaluation. Allowing setup and cleanup time for procedures prevents the room and team from being overbooked, and following provider-specific scheduling preferences prevents conflicts with workflow and procedure needs. Question 5. A medical terminology study note highlights hematmesis. Which definition matches? Option A. Blood present in urine. Option B. Vomiting of blood. Option C. Bluish discoloration of the skin or mucous membranes. Option D. Arterial blood pressure below the expected range. The correct answer is option B. Vomiting of blood. Hematmesis is vomiting of blood. It indicates bleeding from the upper gastrointestinal tract. Hematuria is blood present in urine, while cyanosis is bluish discoloration of the skin or mucous membranes, and hypotension is arterial blood pressure below the expected range. Question 6. Which safety or quality benefit comes from recognizing the T wave as ventricular repolarization when the assistant reviews the waveform after the QRS complex? Option A. Prevents recording the wrong patient or an unrequested procedure. Option B. Identifies electrical activation of the atria. Option C. Identifies electrical recovery of the ventricles. Option D. Improves electrode adhesion and reduces artifact. The correct answer is option C. Identifies electrical recovery of the ventricles. Recognize the T wave as ventricular repolarization. This identifies electrical recovery of the ventricles. Verifying the patient and the EKG order prevents recording the wrong patient or an unrequested procedure, while recognizing the P wave as atrial depolarization identifies electrical activation of the atria. Preparing the skin by cleaning and drying it improves electrode adhesion and reduces artifact. Question 7. The assistant plans to use a Snellen chart at the standardized distance after noting that the assistant performs distance visual acuity testing. Which reason supports this step? Option A. Prevents contamination and preserves reagent minus pad accuracy. Option B. Identifies red minus cell rupture that can alter multiple analytes. Option C. Ensures rapid provider notification and patient follow minus up. Option D. Permits valid comparison with the chart's calibrated notation. The correct answer is option D. Permits valid comparison with the chart's calibrated notation. Use a Snellen chart at the standardized distance. This permits valid comparison with the chart's calibrated notation. Using clean technique for a urine reagent strip prevents contamination and preserves reagent minus pad accuracy, while inspecting a specimen for hemolysis identifies red minus cell rupture that can alter multiple analytes. Reporting critical values ensures rapid provider notification and patient follow minus up. Question 8. After recognizing that the injection area has been swabbed with alcohol, why should the assistant clean the site and allow antiseptic to dry? Option A. Permits identification of local reactions and avoids overlapping sites. Option B. Provides an accessible muscle with site minus specific volume limits. Option C. Improves antisepsis and reduces stinging from wet alcohol. Option D. Limits manipulation of contaminated sharps. The correct answer is option C. Improves antisepsis and reduces stinging from wet alcohol. Clean the site and allow antiseptic to dry. It improves antisepsis and reduces stinging from wet alcohol. Spacing multiple injections permits identification of local reactions and avoids overlapping sites. Using the deltoid for a small minus volume adult vaccine when appropriate provides an accessible muscle with site minus specific volume limits, and discarding the syringe and needle as 1 unit limits manipulation of contaminated sharps. Are you looking for NHA Medical Assistant Exam actual questions? Visit our website pokerexams.com to access NHA Medical Assistant Exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get NHA Medical Assistant Exam answer key today. Question 9. NHA Privacy and Security Review uses the term -identified information. Which description is accurate? Option A. Health information stripped of specified identifiers or determined to have very low re-identification risk. Option B. Policies and management processes for security. Option C. Information released when a law requires reporting such as certain abuse cases. Option D. The document explaining how an organization may use information and the patient's privacy rights. The correct answer is option A. Health information stripped of specified identifiers or determined to have very low re-identification risk. De-identified information means health information stripped of specified identifiers or determined to have very low re-identification risk. It is no longer treated as protected health information under HIPAA. Administrative safeguard means policies and management processes for security. Mandatory reporting disclosure means information released when a law requires reporting such as certain abuse cases. Notice of privacy practices means the document explaining how an organization may use information and the patient's privacy rights. Question 10. Which result is expected from recognizing a needle holder as the instrument for driving a suture needle when the provider begins wound closure? Option A. Supplies an instrument selected for the material and task. Option B. Provides controlled tissue handling according to forceps type. Option C. Reduces hand-to-hand sharps injuries. Option D. Securely controls the curved needle during suturing. The correct answer is option D. Securely controls the curved needle during suturing. Recognize a needle holder as the instrument for driving a suture needle. It securely controls the curved needle during suturing. Recognizing surgical scissors as cutting or dissecting instruments supplies an instrument selected for the material and task. Recognizing forceps as grasping instruments provides controlled tissue handling according to forceps type, and placing used sharps in a designated neutral zone when used by the team reduces hand-to-hand sharps injuries. Question 11. When the provider has limited lifting after a procedure, why should the assistant set realistic activity restrictions? Option A. Prevents accidental intake that could invalidate results. Option B. Prevents injury while clarifying when normal activity can resume. Option C. Reinforces verbal teaching in an accessible format. Option D. Promotes timely response to severe pain, bleeding, breathing difficulty, or other red flags. The correct answer is option B. Prevents injury while clarifying when normal activity can resume. Setting realistic activity restrictions prevents injury while clarifying when normal activity can resume. Reviewing fasting requirements in specific terms prevents accidental intake that could invalidate results, while providing written materials at an appropriate reading level reinforces verbal teaching in an accessible format. Identifying symptoms that require urgent care supports prompt care for serious warning signs. Question 12. Why is preparing a sterile field without reaching across it appropriate when a minor procedure requires sterile instruments? Option A. Gives the patient a safer way to request help. Option B. Straightens the canal while reducing trauma during irrigation. Option C. Provides objective information about hydration and renal function. Option D. Preserves sterility and reduces contamination risk. The correct answer is option D. Preserves sterility and reduces contamination risk. Prepare a sterile field without reaching across it. It preserves sterility and reduces contamination risk. Placing the call device within reach gives the patient a safer way to request help, while positioning an ear for irrigation straightens the canal while reducing trauma during irrigation. Measuring intake and output accurately provides objective information about hydration and renal function. Question 13. Which option accurately defines integumentary system in the area of anatomy and physiology? Option A. The organ system made up of skin, hair, nails, and glands. Option B. The organ system that returns tissue fluid and supports immune defense. Option C. The digestive segment that absorbs water and forms feces. Option D. The gland that releases digestive enzymes and glucose-regulating hormones. The correct answer is option A. The organ system made up of skin, hair, nails, and glands. Integumentary system refers to the organ system made up of skin, hair, nails, and glands and protects the body and supports sensation and temperature regulation. Lymphatic system refers to the organ system that returns tissue fluid and supports immune defense. Large intestine refers to the digestive segment that absorbs water and forms feces, and pancreas refers to the gland that releases digestive enzymes and glucose-regulating hormones. Question 14. What is the main reason to document the patient's exact words for a sensitive statement when a patient makes a concerning comment about self-harm? Option A. Preserves the meaning of the statement for prompt clinical assessment. Option B. Supports safe mobility and effective communication planning. Option C. Distinguishes a true allergic response from an intolerance or side effect. Option D. Clarifies who supplied the information and its possible limitations. The correct answer is option A. Preserves the meaning of the statement for prompt clinical assessment. Document the patient's exact words for a sensitive statement. It preserves the meaning of the statement for prompt clinical assessment. Measuring supports safe mobility and effective communication planning, while recording allergies and the specific reaction distinguishes a true allergic response from an intolerance or side effect. Confirming the source of the history clarifies who supplied the information and its possible limitations. Question 15. How does speaking to a child at an age-appropriate level help when a pediatric patient asks about a procedure? Option A. Communicates respect and improves information gathering. Option B. Verifies accuracy and reduces miscommunication. Option C. Reduces fear without giving misleading reassurance. Option D. Supports orientation, independence, and safety. The correct answer is option C. Reduces fear without giving misleading reassurance. Speak to a child at an age-appropriate level because it reduces fear without giving misleading reassurance. Listening without interrupting the initial explanation communicates respect and improves information gathering. Repeating back critical verbal information verifies accuracy and reduces miscommunication. And describing the environment to a patient with visual impairment supports orientation, independence, and safety. Question 16. Which safety or quality benefit comes from keeping a timed urine specimen under required storage conditions when the collection container requires refrigeration or preservative? Option A. Protects staff and avoids testing a compromised sample. Option B. Limits bacterial growth and analyte deterioration during the collection period. Option C. Provides lower respiratory secretions instead of oral fluid. Option D. Prevents introduction of external microorganisms. The correct answer is option B. Limits bacterial growth and analyte deterioration during the collection period. Keeping a timed urine specimen under required storage conditions limits bacterial growth and analyte deterioration during the collection period. Rejecting or recollect a leaking specimen protects staff and avoids testing a compromised sample. Obtaining sputum from a deep cough rather than saliva provides lower respiratory secretions instead of oral fluid. And not touching the inside of the sterile container prevents introduction of external microorganisms. Question 17. The assistant plans to select needle gauge based on medication viscosity and route after noting that a thick medication is being prepared for injection. Which reason supports this step? Option A. Improves delivery to the intended tissue layer. Option B. Uses a well-developed thigh muscle away from major nerves and vessels. Option C. Supplies required information about benefits and risks before administration. Option D. Balances flow requirements with tissue trauma. The correct answer is option D. Balances flow requirements with tissue trauma. Select needle gauge based on medication viscosity and route because it balances flow requirements with tissue trauma. Selecting needle length based on route, site, and tissue depth improves delivery to the intended tissue layer. Using the vastus lateralis for an infant intramuscular injection uses a well-developed thigh muscle away from major nerves and vessels, and providing the current vaccine information statement before vaccination supplies required information about benefits and risks before administration. Question 18. After recognizing that chest exposure is needed for accurate precordial placement, why should the assistant use respectful draping while locating landmarks? Option A. Protects privacy without sacrificing placement accuracy. Option B. Provides a reliable landmark for counting ribs and spaces. Option C. Provides the landmark needed to position V3 midway between V2 and V4. Option D. Maintains the required horizontal plane from V4. The correct answer is option A. Protects privacy without sacrificing placement accuracy. Use respectful draping while locating landmarks because it protects privacy without sacrificing placement accuracy. Locating the fourth intercostal space from the sternal angle provides a reliable landmark for counting ribs and spaces, while placing V4 before V3 provides the landmark needed to position V3 midway between V2 and V4. Placing V5 level with V4 on the left anterior axillary line maintains the required horizontal plane from V4. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Within basic pharmacology, Which description best explains insulin? Option A. A medication that relaxes airway smooth muscle. Option B. A biological product that stimulates protective immune memory. Option C. A medication that reduces pain, fever, and inflammation. Option D. A hormone medication that lowers blood glucose. The correct answer is option D. A hormone medication that lowers blood glucose. Insulin refers to a hormone medication that lowers blood glucose and promotes cellular glucose uptake and is essential for type 1 diabetes treatment. Bronchodilator refers to a medication that relaxes airway smooth muscle. Vaccine refers to a biological product that stimulates protective immune memory, and nonsteroidal anti-inflammatory drug refers to a medication that reduces pain, fever, and inflammation. Question 20. In CLIA and laboratory quality exam preparation, proficiency testing appears as a key term. Which meaning is correct? Option A. External assessment using unknown samples to evaluate laboratory performance. Option B. The final record of a laboratory result with appropriate identifiers and units. Option C. An error occurring after analysis. Option D. The laboratory category with the most demanding personnel and quality requirements. The correct answer is option A. External assessment using unknown samples to evaluate laboratory performance. Proficiency testing describes external assessment using unknown samples to evaluate laboratory performance. It compares testing accuracy with established expectations for applicable non-wave tests. Patient test report describes the final record of a laboratory result with appropriate identifiers and units. Post-analytical error describes an error occurring after analysis. High-complexity test describes the laboratory category with the most demanding personnel and quality requirements. Question 21. When the patient has difficulty understanding a verbal explanation, why should the assistant use pictures or models when helpful? Option A. Supports informed decisions and appropriate post-vaccine monitoring. Option B. Reduces overload and supports retention. Option C. Adds visual support for anatomy, equipment, or procedural steps. Option D. Makes recommendations more relevant and actionable. The correct answer is option C. Adds visual support for anatomy, equipment, or procedural steps. Using pictures or models when helpful adds visual support for anatomy, equipment, or procedural steps. Explaining vaccine benefits and expected reactions supports informed decisions and appropriate post-vaccine monitoring. Presenting information in small organized steps reduces overload and supports retention, and connecting dietary advice to the patient's condition makes recommendations more relevant and actionable. Question 22. Why is calculating the dose and obtaining an independent check when required appropriate when the ordered amount differs from the concentration supplied? Option A. Supports accurate preparation of higher-risk or calculated doses. Option B. Applies core rights that reduce preventable administration errors. Option C. Allows mucosal absorption at the prescribed site. Option D. Supports safe swallowing and less fluid is restricted. The correct answer is option A. Supports accurate preparation of higher-risk or calculated doses. Calculate the dose and obtain an independent check when required. This supports accurate preparation of higher-risk or calculated doses. Confirming the right patient, drug, dose, route, time, and documentation applies core rights that reduce preventable administration errors. Placing a buccal medication between the gum and cheek allows mucosal absorption at the prescribed site, and offering water with an oral tablet when permitted supports safe swallowing and less fluid is restricted. Question 23. AHIPAA Privacy and Security Review uses the term right of access. Which description is accurate? Option A. A specific written permission for a use or disclosure not otherwise permitted. Option B. A limiting workforce access according to job responsibilities. Option C. A limited secondary disclosure occurring despite reasonable safeguards. Option D. The patient's right to inspect or obtain protected information in a designated record set. The correct answer is option D. The patient's right to inspect or obtain protected information in a designated record set. Right of access is the patient's right to inspect or obtain protected information in a designated record set. It generally applies to paper and electronic records subject to limited exceptions. Authorization is a specific written permission for a use or disclosure not otherwise permitted, while role-based access is limiting workforce access according to job responsibilities, and incidental disclosure is a limited secondary disclosure occurring despite reasonable safeguards. Question 24. In Billing and Coding Basics exam preparation, claim adjustment appears as a key term. Which meaning is correct? Option A. A change to payment or patient balance after processing. Option B. The payer deadline for submitting a claim. Option C. Software that checks claims for errors before submission. Option D. The code set used to report physician services and procedures. The correct answer is option A. A change to payment or patient balance after processing. Claim adjustment describes a change to payment or patient balance after processing. It may result from corrections, contractual terms, or payer review. Timely filing limit describes the payer deadline for submitting a claim. Claim scrubber describes software that checks claims for errors before submission. CPT describes the code set used to report physician services and procedures. Question 25. A CLIA and laboratory quality review uses the term wave test. Which description is accurate? Option A. Documented steps taken after a testing problem is identified. Option B. A laboratory test categorized as simple with a low risk of incorrect results. Option C. The specific complexity and testing authorized for a laboratory site. Option D. An error occurring before the specimen is tested. The correct answer is option B. A laboratory test categorized as simple with a low risk of incorrect results. Wave test is a laboratory test categorized as simple with a low risk of incorrect results. It must still be performed exactly according to manufacturer instructions. Corrective action is documented steps taken after a testing problem is identified, while certificate scope is the specific complexity and testing authorized for a laboratory site, and pre-analytical error is an error occurring before the specimen is tested.